Achoo! Oh, excuse me. It's a beautiful, clear day in Connecticut in May and June. And I'll tell you what, this is when the allergies start kicking up for me. I can sneeze 30 times before I stop. Today we are going to learn about seasonal allergies and how we can have a better quality of life with them, how to control them, and to prevent sinus infections. So our objectives today is to learn about the symptoms of seasonal allergies, which is also called hay fever and allergic rhinitis, the causes of seasonal allergies or hay fever, the risk factors to develop hay fever. We're going to talk about the complications and problems with hay fever, how to prevent the progression to sinus infections, and we're going to talk about medications to treat it and the side effects and other types of remedies you can use out there. So it's beautiful in my yard here. We got flowers blooming and everything. But I'll tell you what, when everything starts blowing around, I know what's coming. In the fall and in the spring, I notice it with my patients and I notice it with myself, that if I start feeling like I'm getting a cold and I've got a post-nasal drip, I'm itching my eyes, and I got a watery nose and a post-nasal drip when I sleep at night, I know here it comes. So I always remind my patients, remember what happened last season, and just remember to get out the medications and start your remedies to prevent any problems from happening. You know, especially when you have an older adult who can't tell you things, it's really important that you let them know that, you know, that you're watching for these changes in their patterns and that here we go again and you're ready to go. So it's a beautiful windy day, like I said, but I can see pollen blowing around, petals blowing around, and there are all sorts of things that kind of cause us to have allergies. There's some other symptoms we should go over. Itchy eyes is one of them, and I tend to get that as well, especially when some pollens really kick up. And an itchy nose, where you actually do this, which is called a allergic salute. It's like a salute. And you can get swollen blue colored skin under the eyes, so you look like you're just worn out, and it's just from all the allergens around you. So what actually causes hay fever? Well, according to the Mayo Clinic, hay fever is cold-like symptoms. They're described like we said above, and it's a reaction to pollen, dust mites. It can be even tiny flecks of skin and saliva from our cats, dogs, other animals, and from fur or feathers. So unfortunately, you know, I'm probably a little allergic to my cats, but there's no way I'm getting rid of them. I love them. But, you know, I have to, when I brush them and when I pet them, sometimes I start sneezing, and that may be the problem. Some other risk factors for getting hay fever or developing them is that you have other allergies to other things and or having asthma. That you have something called atopic dermatitis, that is eczema. It's kind of like a dry, flaky skin that you notice, and it's kind of itchy, and you want to put cream on it. That is definitely a sign, because our skin does show us a lot of things that can happen inside of us and other types of illnesses, so it's good to always see if you have allergic dermatitis. If you have a mom, a brother, or some other blood relative who has seasonal allergies or asthma, you're more likely to develop that. My father definitely had asthma, and I developed exercise-induced asthma, so I take like a Proventil before I go for a run or a walk, just so I don't get tight when I'm breathing. But I also have seasonal allergies, unfortunately. If you live or work in an environment where there are constantly exposing you to allergies, and allergens, then you probably going to get at risk of developing seasonal allergies or some kind of problems there. And believe it or not, if you've had a mom who smoked during your first year of life, you are at more risk of developing seasonal allergies. Interesting. So what are some of the complications from having allergies? Well, I'll tell you one thing I hate, well, in addition to the complications but problems, is this darn post-nasal drip. I'm always swallowing mucus. It tastes terrible. It smells terrible. I think it gives me bad breath. It makes me tired. It reduces productivity for a lot of people, and sleep is reduced also because you're lying down and the drip just keeps going down the back of your throat no matter what you do. It can worsen asthma by increasing your coughing, wheezing, and sneezing. And it could lead into prolonged congestion, could lead into sinus infections. And that's where you don't want to go, because then you land up on antibiotics, which certainly could have been prevented. And sinusitis is when the membranes, and we're going to go over that in a few seconds, are inflammation of the membranes in the sinuses of your nose and in your head. There's also ear infections that you can get because there's other areas of anatomy that get involved. And let's stop for a minute and let's go over the anatomy, because I think it's important that you know what the nose looks like. So what we're going to look at here, and I'm just going to reduce this a little bit so you can see. So this is what our nose looks like, and healthy sinuses look like this. They're nice and pink. This is the nasal cavity. These are called turbinates. They're little lumps in our nose, and when you look up the nose, you can see these little lumps. They should be nice and smooth and not inflamed looking. And if you look a little further down here, you'll see all the sinuses. Those are maxillary sinuses right on your cheeks. These are the ones that go up into your nose that we can look up with the otoscope and actually look up the nose. These are your frontal sinuses, and these are called ethmoid, the little tiny ones around your eyes. And then this is the eustachian tube that goes to the ear, and that's why babies and children, you see how thin this little tube is, gets infections easily because their passages are so small and the mucus just has nowhere to go, leading to infections. Now this is a healthy looking sinus, and I had CAT scans of my sinuses, and I actually have small sinuses on the right side, so I don't drain well. So you can anatomically be off as well. So CAT scans of sinuses does help you. So we're just going to look at a couple things here. I wanted to show you, first of all, like a common cold. When you look at the common cold, sorry about that, you see all the fluid. It's a whitish discharge. It's coming down around your sinuses, and you do get a post-nasal drip. And we all know what a cold is like. We're runny nose. We're blowing it all the time. It's clear stuff. It just won't stop. And it can last up to 7 to 10 days. And you do have an inflamed nasal lining, and you do have a post-nasal drip, like we mentioned. Now, when you have allergies, look at the change of the color of the sinuses. They become more bluish and definitely different color. You could definitely see the difference, like I mentioned, when you look up the nose with the otoscope. The mucus is thin and clear and watery, but it's also copious. There's so much of it. And if it goes on, it leads to sinus infections. And what happens is, because the sinuses are so inflamed and so full of mucus buildup, see the water here is building up here in the sinuses all along your nose. After a while, if you don't take care of the problem, the mucus becomes green and the color changes, and all of a sudden now you have a sinus infection. Fevers, headaches, frontal headaches, you feel really in the fog, you feel terrible, and it leads to you needing an antibiotic. And so for our patient, the more that you take care of the problem so it doesn't progress to a sinus infection, the better you'll be. And it can be done. So if you make sure that you, number one, what you need to do is drink plenty of fluids. That is absolutely required. And I always fill up a bottle like this every day, and I start using this, taking that right away. Another thing that's really cool is something called a Sinu wash or a Sinu cleanse. It comes like this, like a little genie bottle. You could buy this in any pharmacy or any grocery store. And this little opening goes into the nose. You fill this to the line inside with warm water, and you could buy these little individual packages of saline that go in. You mix it up really good. You go in your bathroom over the sink, and you actually pour with your head forward, of course. If you do backwards, you're going to drown yourself. But if you put your head forward and you do in one nostril, it'll actually go over the top, wash your sinus out into the sink, and come out the other nostril. And then you go to the other side and you do the same thing. I'll tell you what, this is really nice to do. It's very cleansing, very soothing. It washes out your sinuses. It feels really great. And I do that when I have sinus infections, and I do it when my sinuses are really bad, just to get the pollen and everything out of my nose. There's also nasal salines you can get over the counter. This one's called Air Nasal Mist. You know, it comes out like a mist. It just, when you spray it, it just sprays out. So if you put that up into your nose, it will actually spray up into your nose, give you some moisture, maybe allow you to sneeze, and you can actually push some of this, blow some of this stuff out so it doesn't get infected. Another thing that is really great is using a nebulizer. They look like this. Sorry. Looks like this. It's a nebulizer. Comes with a tubing, and it has a mask. You could put distilled water in this little cup, fill it up, sit back, turn it on, put this on, and it will actually mistify as you're breathing in and out all this nice mist and fluid. A humidifier is really good, similar, but this is like right on you, which is great. The humidifier could be in your room. As long as you keep it clean, you keep it across the room, and an ultrasonic nebulizer is even better because it's really tiny particles like we use for babies, so it really makes the mist, make the air full of mist so that when you breathe, you're breathing in nice moisture. Hey, I'm sorry if there's noise up there. Everybody's in the pool but me, so we'll just talk over it. I also have this cricket over here in the bushes, and he's like making a lot of noise, but hey, as long as he doesn't bother you, he doesn't bother me. Okay, some other things that people try when they're just really congested is Sudafed or neosynephrine. Now those are temporary use items only. If you use them more than 3 days, you miraculously feel better, but then all of a sudden you get snap, rebound congestion, and the congestion is really bad, and then you have to keep using it because you can't stop, because you got addicted to using it, and it's just a rebound effect. So try not to get stuck on Sudafed. It also raises blood pressure, and it can give you headaches, and you can't sleep at night. Keep it to only up to 3 days, no more. Better yet, it'd be better if you move into some oral antihistamines such as Clarinex or Claritin, Zyrtec, Allegra. All these are over the counter now, even Flonase, which is a nasal spray, and I'll go over how to use that in a minute. Cromolyn sodium is an over-the-counter nasal spray. It works by reducing histamines, which are compounds that actually cause local immune responses, and it has less side effects than others, and that's also over the counter, and it's a nasal spray. So I guess we should go over how to use a nasal spray. I take Dymista, which I had been on Flonase, didn't do enough for me after all these years, and I had to progress to something called Vastaline and Flonase in it. And it's 2 sprays each nostril once a day. This is a prescription for me. So what I teach my patients is blow your nose, look at your toes, and you're going to cover your nostril. And usually if you cover this one, actually if you go like this and you cover, you can go 2 sprays, so sniff it up, and then put it in this and go like this, 2 sprays. And then you sniff it up with your head down. If you put your head back, you're going to taste it, and that way you wasted it. You like my rhyme? So you do not want to put your head back to do a nasal spray. It just goes right down your throat, and you lost all the medication. You want to sit right here. Now that you know where the sinuses are, you want the medication to actually move into this sinus here, and then spin over here, and that's by putting your head forward and sniffing it up and putting the, putting this in your nose so it goes like this almost towards the sinus, okay? There's also something called Singulair, which is Montelukast. You can also get that. It's a leukotriene modifier, and it works by blocking the action of leukotrienes, which are immune system chemicals, and they also are known to increase mucus, and it helps, mostly used for people with allergies and induced asthma. There's also something called nasal ipratropium. It relieves a runny nose by preventing the glands in the nose from producing excess fluid as well. A side effects though is nasal dryness, and if your nose is too dry, it's going to bleed, and you're going to want to pick it because it feels irritated, and then you'll bleed some more. So make sure you use your nasal saline if you're going to use the ipratropium. Also, it could cause dizziness, and it could also cause difficulty urinating. So if you're a gentleman with prostate issues, do not use ipratropium, okay? There are also oral corticosteroids, which are steroids, which we all know, like prednisone. It helps with inflammation, but it's only for short-term use. It has all sorts of problems like increasing your blood sugar. It can also change your sleep habits, fluid retention. It's just not a good thing. High blood pressure over time, so it's a short-term use. I love Mucinex and any mucolytics like that. I think you need to break up the mucus and thin it. So as long as you're using a nasal saline, you're keeping the allergens down by a nasal spray or some kind of antihistamine, you're drinking plenty of fluids, the Mucinex will help prevent you from going into the sinus infection. And believe me, you'll know, because allergies stay clear and the mucus is going on, but when you get that infection, you get hit by a brick. I'll tell you, you just feel terrible. Also, there's eye drops. So if you have problems with your eyes, there's a couple drops called Aloe or Patanol. They're prescription, but they're drops that go so that the medication sits on your eyeball, so the allergens do not irritate your eyes and you're not rubbing them. We talked about Cleanse, we talked about air. If you have sinus problems that just don't go away and you just are not sure if that's all there is, you could find out, like I did, that I'm just not built right in my sinuses and why I have all this trouble. I actually went to an ears, nose, and throat specialist who looked up in my sinuses, took a good history, and we did a CAT scan of my sinuses and did find out that my anatomy is why I kept getting sick. So I try to maintain the saline and the fluids and take my allergy medicines right away when the season starts, otherwise I'm in trouble. So, from Nancy, the nurse practitioner, here from Caregiver Success, thanks for visiting my YouTube channel. I also have a book called Caregiver Success on my webpage called caregiversuccess.com with all this information in it, including lots of other stuff for you. So you stay well and enjoy your beautiful days. Just take care of your allergies. Okay, bye-bye for now.